All right, so get this. Today we are going deep on bioelectronic medicine.
Oh, wow.
Yeah. Specifically, we're going to be exploring vagus nerve neuromodulation.
Okay.
It's pretty much a new frontier.
Really?
Yeah, and it's showing incredible potential treating all sorts of
Oh,
conditions.
wow. That sounds fascinating.
Yeah, so first off, for anyone who needs a refresher, the vagus nerve is like the body's communication hub.
It is, yeah.
It's this huge nerve that connects your brain to your organs,
Hmm.
and it influences everything from like your mood to your heart rate.
Yeah, it's a very crucial pathway.
Yeah, and what's crazy is we're beginning to understand how to modulate its activity.
Wow.
And that can treat potentially a huge range of conditions, like
Oh, look.
think depression, heart disease, epilepsy, and even help people recover from comas.
Wow, that's incredible.
Yeah, and so we're actually going to be looking at a recent scientific review paper
Okay.
that analyzed over 100 studies on vagus nerve stimulation.
So we're talking cutting edge.
Absolutely, the absolute latest insights on this field.
That's great.
So before we get into the nitty-gritty of what this therapy can do,
Okay.
let's break down how it actually works.
Yeah, how does it work?
Well, it involves a non-invasive device,
Like a what?
often like an ear clip.
An ear clip.
Yeah.
Wow.
And it delivers these mild electrical pulses to stimulate the vagus nerve.
So you just like clip it on and it just sends pulses.
Yeah, and what's remarkable is that we can adjust different parameters,
Oh, okay.
like the intensity of the pulses, how long each pulse lasts, and how often they're delivered.
So it's tunable. Like we can tune it?
Yeah, and by fine-tuning those parameters, we can target very specific effects.
Wow. So it's not just like a one size fits all.
Right.
It's like you can actually personalize it.
Yeah, it's about tailoring the stimulation to each person and their specific needs.
Wow. That's fantastic.
And this review paper actually looked at a huge amount of different health areas where vagus nerve stimulation has been studied,
How many?
like 21 different health areas.
21.
It seems like the possibilities are endless.
Wow, the breadth of potential applications is really exciting.
Yeah, it really speaks to the interconnectedness of our body systems.
Yeah, definitely.
But let's focus on some of the areas where the research is showing the most promise.
Okay.
One of the most striking findings was in the field of depression.
Oh, really?
Yeah, this review actually found that 11 out of 11 studies,
Wow.
that's every single study
Every single one.
on vagus nerve stimulation for depression, showed improvements in symptoms.
Wow, so 11 out of 11. That's incredible.
What does that tell us about the brain's ability to change and adapt?
You know, it really challenges this idea that depression is only a chemical imbalance.
Right.
This consistent positive response that we're seeing to vagus nerve stimulation points to a strong link to like neural circuitry.
Yeah.
It could say we're essentially rewiring the brain to function in a healthier way.
It's like giving the brain a nudge in the right direction.
Yeah, exactly.
Now, another area where vagus nerve stimulation is showing crazy potential is heart health.
Oh, wow. Okay.
What we're seeing is that VNS can improve something called heart rate variability.
And that's important because...
Well, it's a major indicator of cardiovascular health.
Okay.
It's a measure of how flexible your heart is in responding to different situations.
So a more variable heart rate is actually a good thing.
Exactly.
Okay.
It means your heart is more adaptable and resilient.
Uh-huh.
And on top of that,
Yeah.
VNS appears to reduce inflammation.
And we know that inflammation is one of the leading...
Huge contributor to heart disease.
Yeah.
So you can see why this is so exciting. It could be a game changer for both preventing and treating heart conditions.
Absolutely. That's incredible.
And we can't forget about stroke recovery. This therapy could be absolutely life-changing
Yeah.
for people struggling with the effects of a stroke.
What do we know about that?
Well, the research suggests that vagus nerve stimulation can enhance neuroplasticity in the brain after a stroke. And this basically means it helps to rewire those neural pathways that were damaged.
Wow.
Yeah, and this can lead to improvements in motor function, speech, and cognitive abilities.
That's incredible.
It's fascinating how stimulating this one nerve, the vagus nerve, can have such a broad impact on the brain and body.
Yeah, it really is.
And I was actually really intrigued by the connection between vagus nerve stimulation and COVID-19 recovery.
Oh, interesting.
Yeah, especially when it comes to easing those lingering depression symptoms that people experience.
I see.
It's a very timely area of research.
Yeah, definitely.
It points to the potential of this therapy to address a wide range of post-viral syndromes,
Wow.
not even just limited to COVID-19.
Okay.
So as we learn more about the long-term effects of these infections,
Yeah,
this type of therapy could become increasingly crucial.
I see. see, yeah.
So we've touched on depression, heart health, stroke recovery,
Uh-huh.
but the applications seem to go way beyond that.
Okay.
What about things like epilepsy, migraines, even post-coma recovery?
So, like, are those areas where this is also showing promise?
Yeah, all areas where vagus nerve stimulation is showing promise.
Wow.
And it almost seems counterintuitive to use electrical stimulation for a condition like epilepsy.
Yeah, especially because that's like electrical storms in the brain, right?
Exactly. But the research is showing some intriguing results.
So it's not just about symptom management.
Right.
It's about potentially addressing the root cause.
Exactly. It's about modulating the activity of this one central nerve pathway, the vagus nerve, to influence a huge range of physiological processes.
That's really incredible.
Now, one thing that stood out in the review was the importance of treatment duration.
Okay.
Longer stimulation periods, like hours per day,
Wow.
over weeks, or even months, seem to lead to better, more lasting results.
Oh, wow. So consistency is key.
Consistency is key, just like with anything else.
Yeah.
And it suggests that we're not just temporarily interrupting unhealthy patterns, but actually promoting long-term changes in the nervous system.
Oh.
This is crucial for designing effective treatment protocols and maximizing the potential for long-term benefits.
Yeah.
Now, I know what some listeners might be thinking. What about side effects?
Yeah, of course.
I'll admit I was a bit apprehensive about that too.
Yeah. With any medical intervention, there are always potential risks.
For sure.
But what's interesting is the side effects that are reported with vagus nerve stimulation are mostly mild
Oh.
and localized.
Like what?
Things like redness or maybe a tingling sensation at the stimulation site.
Okay.
And they're usually temporary and manageable,
Mm.
especially when you weigh them against the potential benefits we're seeing.
And I actually have a funny anecdote here.
Okay.
I know you've tried vagus nerve stimulation yourself
Yeah.
and have experienced some of these side effects firsthand.
I have.
Would you care to share?
I have definitely felt a little itchy after longer stimulation sessions.
But it's a very small price to pay for the potential benefits.
Absolutely.
So it's not all sunshine and roses. But the potential upsides seem to far outweigh the downsides.
I agree, yeah.
Vagus nerve stimulation is still a relatively young field,
Yeah.
but we've stumbled onto something incredibly powerful.
Absolutely.
It has the potential to revolutionize how we approach health and healing.
I agree, yeah.
And it's amazing to think that by stimulating this one nerve,
Yeah.
we can potentially improve so many different aspects of our health.
It really highlights how interconnected our bodies and minds are.
Absolutely.
It challenges us to think beyond traditional boundaries when it comes to health and healing.
We've covered a lot of ground in this first part of our deep dive into vagus nerve stimulation.
Yeah, it's been really interesting.
But stay tuned for part 2, where we'll delve even deeper into the specific applications of vagus nerve stimulation
Okay.
and explore what the future might hold for this groundbreaking technology.
I'm excited for that.
Yeah, me too.
All right.
Stay with us.
Yeah.
Welcome back. Still reeling from all this stuff about vagus nerve stimulation. It's mind-boggling.
Yeah, for sure. Lots to unpack.
In this part, let's zoom in on some conditions
Yep.
and unpack the research a little more.
Sounds good.
We talked a lot about depression in the first part.
Yeah.
Can we dig into that a bit deeper?
Yeah. What I find interesting is vagus nerve stimulation. It seems to work differently than antidepressants.
Oh, really?
Yeah. The ones you see advertised all the time.
Right.
The ones that mainly focus on like serotonin, those neurotransmitters.
Right. Boosting serotonin levels.
Exactly. But with VNS, it's not just chemicals.
Okay.
It influences the brain's electrical activity.
Okay.
It seems to be promoting something called neuroplasticity, the
Right.
brain's ability to change and adapt.
So it's like we're helping the brain rewire itself.
Yeah, for better mood regulation.
Give the brain the tools it needs to heal itself.
Exactly.
That's pretty remarkable.
It is.
You mentioned earlier you're particularly excited about heart health.
Yes.
Tell us a bit more about that.
Well, what we're seeing is that VNS can improve heart rate variability.
Heart rate variability?
Huge when it comes to cardiovascular health.
Okay.
Basically a measure of how flexible your heart is
Okay, how it responds.
in different situations, yeah.
So a more variable heart rate is good.
Exactly.
Okay.
It means your heart is more adaptable, resilient,
Mm-hmm.
and on top of that, VNS seems to reduce inflammation.
Right, which is
It's a major culprit in heart disease.
Yeah.
So you can see why this is exciting.
Yeah.
Could be a game changer for both preventing and treating heart conditions.
Thinking back to that review,
Yeah.
weren't the results overwhelmingly positive
They were, you're remembering correctly.
for heart-related issues?
Yeah, 9 studies that focused on heart disorders and stroke recovery.
Wow.
All of them showed positive outcomes.
So all 9.
Yeah, every single one.
That's really promising,
It is.
especially for something like stroke recovery.
Yeah.
Can you paint a picture for our listener of what that kind of recovery might look like?
So imagine someone who's had a stroke,
Okay.
struggling with things like walking or talking.
Yeah.
VNS, we're seeing it can help rewire those neural pathways.
The ones damaged by the stroke.
Exactly.
Wow.
People facing permanent limitations could potentially regain some of their function.
That's incredible. Gives me chills just thinking about it.
Yeah.
So we've talked about depression, heart health, stroke recovery. The applications of VNS seem to go way beyond that.
They do.
Epilepsy, migraines, tinnitus, insomnia.
Right.
What can you tell us about the research in those areas?
It's a fascinating landscape of possibilities.
Yeah.
Epilepsy.
Okay.
It's almost counterintuitive to use electrical stimulation.
Right, because it's caused by electrical storms in the brain.
Exactly, but that's what's happening.
And it's showing promise.
Yeah.
Controlled chaos to calm down a bigger storm.
Yeah, I like that.
Migraines.
Oh, yeah.
I suffer from those, so I'm curious.
Migraines, another area where the research is really intriguing.
Okay.
VNS seems to work by influencing the trigeminal nerve.
Okay.
It plays a major role in migraines.
Right.
Not a cure. Could be a valuable tool for managing those attacks.
What about insomnia?
Yeah.
Sleep is so fundamental to well-being,
It is such a widespread problem.
and so many people struggle.
VNS might offer a new avenue.
Okay.
Research is still early,
Okay.
but suggests that VNS can promote relaxation and improve sleep quality.
So people with insomnia.
Exactly.
That's great.
And tinnitus.
Yeah, oh yeah, that ringing.
That constant ringing in the ears.
Yeah, it can be so disruptive.
Some studies suggest VNS could modulate the neural activity
Okay.
that contributes to tinnitus.
Offering some relief.
Exactly.
It's amazing how this one therapy can address so many issues.
It is.
Curious, how does the research on VNS for post-coma recovery compare?
So that's a fascinating area of research.
Yeah.
Somewhat limited.
Okay.
It hasn't been as extensively studied as depression or epilepsy,
Right.
but the results are quite compelling.
Okay. Elaborate on those findings.
We've seen cases where people who were in a coma
Yeah.
for extended periods showed improvements in consciousness and responsiveness after receiving VNS.
Wow. So after...
Yeah.
Yeah, it's as if the stimulation is helping to reawaken the brain.
Like restoring
the
communication.
nervous system, yeah.
Sounds like science fiction come to life.
It does a bit, yeah.
So we've covered a lot here.
We have.
One last question.
Okay.
Ethical implications of all this.
Right.
We're talking about manipulating the nervous system.
Yeah. It controls so much of who we are.
It's a crucial point. A
It's-
conversation we need to have as this technology advances.
Absolutely.
We're not talking about mind control or anything.
No, no.
VNS is about working with the body's natural systems.
Yeah, not overriding them.
That's reassuring.
Yeah,
But there's still a lot of nuances to consider.
absolutely. For example,
Yeah.
we need to ensure this technology is accessible to everyone.
Not just those who can afford it,
Exactly. And we need to be mindful of unintended consequences.
even if they seem unlikely.
Yeah, it's like any powerful tool,
Right.
potential for good and harm. We need to use it wisely.
Responsibly.
So what are researchers and policymakers doing to ensure that?
Well, there's a lot of emphasis on ongoing research,
Okay.
rigorous safety protocols.
Makes sense?
We need to carefully monitor for any long-term effects.
Right.
Make sure we're not creating unforeseen problems.
We can't just rush into this blindly.
No,
But at the same time, it feels like we're on the verge of something transformative.
I agree. Vagus nerve stimulation has the potential to revolutionize how we approach health and healing.
Not a panacea,
Yeah,
but a powerful tool.
could help countless people live healthier, happier lives.
Feeling a sense of optimism after learning all of this.
Me too.
We still have one more part to go.
We do.
In part 3, we'll talk about what the future holds.
Sounds good.
Welcome back to the final part of our vagus nerve deep dive.
It's been a journey,
It really has.
exploring all these intricacies.
Yeah, and it feels like we've only just scratched the surface.
Oh, yeah, absolutely.
So in this last part, let's look ahead.
Okay, the future.
What does the future hold for vagus nerve stimulation?
One thing's for certain, research is just going to accelerate from here.
Right?
As we gather more data
Yeah.
and refine our understanding,
Mhm.
we're likely to uncover even more applications.
One thing that keeps coming up for me is neuroplasticity.
Oh, yeah.
The brain's ability to change and adapt.
Right.
VNS is tapping into that in a profound way.
It absolutely is.
It's a fundamental shift in how we think about the brain.
Yeah.
It was believed that the brain was fixed after a certain age.
Right.
Not true at all.
Nope.
The brain is constantly rewiring itself.
In response to experiences.
And VNS seems to be enhancing that process.
Absolutely.
So it's not just about treating existing conditions.
Right.
It's about boosting the brain's capacity for healing.
And growth.
For growth. Wow.
Really exciting implications.
Like what?
Imagine using VNS to help people recover from brain injuries more effectively.
Yeah.
Or prevent cognitive decline.
As we age.
Yeah.
It's like we're moving from disease management to brain optimization.
That's a great way to put it.
And that could have a huge impact on how we approach health.
In the years to come, definitely.
So we've talked about the research expanding and this focus shifting toward brain optimization.
Uh-huh.
What about the technology itself?
Okay, yeah.
Do you see VNS devices becoming more sophisticated?
Definitely. Right now, they're pretty simple.
Right.
They deliver electrical pulses,
Yeah.
and we adjust the parameters.
Right.
But in the future, we could see devices that are way more targeted,
Okay.
more personalized.
So instead of stimulating the whole vagus nerve,
Yeah.
we could target specific branches
Exactly.
for more precise effects.
We could even see devices that use feedback.
The feedback.
Yeah, to adjust the stimulation in real time,
In real time.
based on what that person needs.
It's like having a mini computer inside your body,
It is, yeah.
constantly monitoring your nervous system.
Yeah. Not science fiction anymore.
Yeah.
That's where the field is heading.
I'm curious about how VNS might be integrated with other therapies.
Okay. Yeah.
Do you see it being used alongside medications?
I think integration is key.
Okay.
VNS isn't a replacement for other therapies.
Right.
It's a tool that can be used in conjunction
Okay.
to optimize outcomes.
Oh.
So, for example, use VNS alongside psychotherapy
Oh, interesting.
to enhance talk therapy
Okay.
or alongside medication.
Reduce dosage.
Yeah, or side effects.
It's about finding the right combination.
Exactly, and that's where the healthcare provider is key.
Right.
They need to be knowledgeable about VNS.
And how to integrate it.
Absolutely, into a holistic treatment plan.
Speaking of healthcare providers,
Yeah.
I'm wondering about the role of training and education.
Oh, it's paramount. As VNS becomes more widely adopted,
Yeah.
we need to ensure healthcare professionals are trained.
Trained in its use.
Yes, this includes understanding the science,
Huh?
but also the practical aspects.
Using the devices.
Yeah, interpreting results.
So it's not just the technology.
Right.
It's about a whole ecosystem of knowledge around it.
Absolutely, and that ecosystem needs to include everyone.
Everyone.
Healthcare providers,
Okay.
researchers, engineers, policymakers, and the patients.
It's a collaborative effort.
It is to bring this technology to its full potential.
I believe we'll see VNS transforming healthcare in the years to come.
I agree. It has the potential to touch so many lives.
Well, after this deep dive with you, I can say the future of vagus nerve stimulation looks incredibly bright.
I agree.
It's been great.
It has. Thank you.
To our listeners, thank you for joining us on this deep dive into the world of vagus nerve stimulation.
Yeah, thanks for listening.
If you're interested in learning more, be sure to check out the show notes for links and other resources.
Yeah, we'll have a bunch of stuff there.
And until next time, keep exploring, keep learning, and keep those vagus nerves humming.
That's a great way to put it.